Hello, everyone. We have in our 8th season today, and I'm very grateful to all our followers. I always like to put internal and external resorption because either one, internal is the easiest, and never let a dentist take your teeth out if they tell you that you have internal root resorption. And even if they said that you have external root resorption, you can contact me through my channel, and I will be happy to talk to your dentist at any cost. So I want you to learn that today for this lady was a traumatic situation. She had the whole front area of her teeth. Imagine that all of this area was destroyed and was creating a really bad space that she didn't want to smile anymore, but she didn't want to lose the teeth and have implants, because today we have to do a treatment plan. Your dentist have to tell you that this is your treatment plan. You can have extraction and place an implant, or maybe they can tell you you can keep the tooth through a root canal and resorption treatment that unfortunately many people doesn't know yet in our dental field. Or if you're lucky and they tell you that it is, or you can leave it like that until the tooth falls alone, because this resorption will continue destroying the tooth. And this is not a disease. This is a reaction, immunological reaction of our cells, because they think they're remodeling the bone, because this was some type of a trauma the patient suffered. So when we decided to save the tooth, she was happy, and we placed a little material here. It's called MTA, mineral trioxide. The majority of the endodontists know how to work with this material. That works amazingly in the mouth. You don't need to know, that's our job. What you need to know that if you have an external resorption like this type, most likely in my situation, I have to do a surgery, place a material that we call Geristore in order to keep the structure of the patient. And before we did the whole treatment, of course, we always like to evaluate the destruction of the resorption and what is the amount that we have of a tooth structure. So it looked like a huge destruction in this area of the CT scan. However, the destruction is really not as bad as it shows, and that's why technology is today and days for us is a big asset to determine when we have difficult diagnosis, like in the situation of a root resorption. And it's immunologically, and that was part of my PhD studies. That's what I've been working since '96 in this topic at USC, but with patients. And patients have show you that you can keep the treatment with a good prognosis of 10 years, 15 years, 20 years. But sometimes if the patient is grinding, they don't wear an eye guard, the treatment most likely will fail because the cells perceive the trauma and they start alone creating this type of enzymes that are gonna give the signal into the cells that destroy the surface of the root and continue until the tooth disappears or fell out of the mouth of the patient. So if you wanna keep a nice smile, remember, brush your teeth, floss, perfectly. We have an episode 2 in season 1. However, we're gonna have another class, what is the best way to avoid visits to the dentist every 3 months and allow your dishes to look healthier and feel healthier through a good brushing technique and flossing technique. If you have any questions about our patient or about root resorption, you can contact us through the channel of Dr. Fanny Yacaman. Thank you.